All right, thank you very much to those who have joined us. Very welcome to this webinar on perspectives on robust evidence and effective implementation from the Global South. This conversation with Powell should be a really exciting opportunity for learning. Just to introduce myself, my name is Mary Abdo. I am Managing Director at the Center for Evidence and Implementation. And I'm joining you today from where I live and work in Singapore. We're also joined by Shobini Mukherjee, who's based in New Delhi, and Anna Kilpatrick, who is based in Cape Town. So this is a very global event today. And in fact, we have representatives from almost 30 different countries who have registered for this event. And that includes folks who've signed up anywhere from Cameroon to Chile to Canada. So I'd like to start quickly with a bit of housekeeping before we dive into the topic. So first of all is that we are saving some time at the end of our panel discussion for your Q&A. And so please use the Q&A function at the bottom of the screen to ask questions of presenters throughout the webinar. The second piece of housekeeping is that you should also please make use of the chat function to contact IT support. So to provide a bit of context, this virtual series event is one in our monthly program of webinars aimed at the global evidence and implementation communities. And this is actually in the run-up to the Evidence and Implementation Summit, which will be in March next year. We are really pleased to share that EIS 2021 is now embracing a fully hybrid format. So that's going to involve a lot of fun and different kinds of planning on our side, and will also allow folks who are registering and would like to submit abstracts to indicate whether or not they would like to participate virtually or in person. So some key dates for your diary is a new abstract submission closing date, which is the 6th of October, and an early bird registration, which closes on the 8th of December. So please get those abstracts in. We'll be really excited to join you, to have you join us at that event next March. So now let's turn to our panel discussion and why you all came along today. So by way of context, I would like to quote a recent article co-authored by Dr. Ruth Stewart, Director of the Africa Center for Evidence, and in fact, a keynote speaker at next year's Evidence and Implementation Summit. We've actually shared this on the EIS Twitter feed, so if you'd like to go and find this article, you can find it there. So Dr. Stewart and her co-authors write, the evidence-informed approach to policymaking and implementation is at its core about better decisions for a better future. And the article goes on to say, because of this, there's arguably a moral, economic, social, and political case for paying closer attention to evidence-informed decision-making ecosystems in the Global South. So we are interested in paying closer attention, and that is why we are holding this webinar today. Evidence and implementation ecosystems in South Asia and Sub-Saharan Africa and elsewhere in the Global South are increasingly resilient with strong structural foundations, significant and growing capacity, and complexity and maturity that the global movement has much to learn from. So today promises to be a really lively discussion with two leaders from Powell. By way of introduction to Powell, in 2019, Powell co-founders Esther Duflo and Abhijit Banerjee and their longtime research affiliate Michael Kramer won the Nobel Prize in Economics. The organization is recognized as one of the world's foremost research institutions working to reduce global poverty by providing policymakers with clear scientific evidence on what works. So let me, without any more delay, let me introduce our two speakers from Powell. So we're joined by Shobini Mukherjee, who is Executive Director of Powell out of the South Asia Regional Center. She is based in New Delhi and provides strategic, technical, and administrative oversight to the Pan-India research and multi-sector policy and training engagements in the South Asian region. Anna Kilpatrick is the Deputy Executive Director at Powell Africa, where she oversees operations and select research and policy projects. Prior to joining Powell, she was a project leader at Boston Consulting Group. So let's dive right in. Anna and Shobini. I'll have Shobini respond first to this question, and then I'd like Anna to pick it up. So first, can I start by asking, what is your perspective? It's a very broad question on the current landscape for evidence-based policy in the diverse context that you're working in. would you say that there is increasing interest in this work and an increasing recognition of its importance? And if so, why?
Thanks, Mary. Thank you for having me on. It's a real pleasure to be a part of this conversation. So let me begin by saying that the one thing that this pandemic has done is to bring science at the forefront of decision making. So whether it be vaccine development or in experimenting with different strategies, in containing the spread of the virus or encouraging good behavior, for example, for hand washing and social distancing. So what this COVID-19 has done, it has put the spotlight on the need for scientific evidence to inform decision making, and also on RCTs as a methodology, on randomized controlled trials as a methodology. So as you know, randomized evaluations as a method is a methodology that originates from the medical sciences, and it gives a precise answer, it establishes causality, and it sheds light on what we know, or things that work or don't work. So I will argue that evidence from randomized evaluations, which is the methodology that JPAL employs across its breadth of research, it's sort of changing how policymakers start looking at evidence and how we use this methodology to address problems related to poverty. Policymakers, I mean, we've been working now in the South Asia region for over a decade, almost 12, 13 years, and globally, of course, more than 15 years. And over the last couple of years, I've seen the landscape change in terms of policymakers, practitioners, donors, funders worldwide are increasingly applying this learning to social policies and programs. So I do see a lot of interest, and especially at a time like this, there is even more renewed interest and focus. And as I talk about how JPAL uses randomized evaluations in our efforts to be more evidence-based and use it as a scientific approach to fight poverty, let's start with the present. We are in the midst of a pandemic. Some countries have peaked, some are seeing their second phases. And there's so much that we cannot predict about this, at least not till a vaccine is created. So what this pandemic has done is also shining a light on the gaps that are so wrong within the systems that currently exist. So if you look at service provision in poorer countries, if you look at the status of health infrastructure, there are a lot of other systemic and systemic issues that are emerging in the social sector. So as we think about the current landscape of evidence-based policy and our response to COVID-19, using the methodology of randomized evaluations, I strongly believe that evidence to policy organizations like ours, like JPAL and many others, have a very critical role to play. In such a situation, evaluations and evidence both have an important role to play. So right away, of course, in the public health response, as you can see, whether we are addressing some of the behavior changes, how we are looking at sort of containing spread of the virus, but even beyond public health in addressing the social sector issues we are seeing in India, for example, with respect to tackling poverty, hunger, learning, looking at identification and targeting the most vulnerable, supporting children catch up when schools reopen, conditional, unconditional cash transfers, and so on. So I feel that, having said that and argued for the case of randomized evaluations at a time like this and an evidence-based policy making at a time like this, most importantly, there are challenges to applying this to decision making. There are challenges in applying sort of an evidence-based lens to decision making in a normal world. If you think about it, policy making is already constrained by several barriers. In my more than a decade of working with policymakers very closely, so we in JPAL, we've coined this term called the 3 I's. We look at, it's called inertia, ideology, and instinct as the barriers to decision making when we are working with policymakers. So ideology often comes in the way of evidence such that you have a fundamental objection to certain principles. So incentives, take for example, incentives, it's the most maligned and most underappreciated tool, I believe, in policy making. So if you think about, I can give you a very quick example. If you think about incentives to boost immunization for under 5, and sort of looking at low immunization rates, but also reaching the last mile, policymakers often feel that this is a must do for parents, and And so why incentivize them for something that's already their parental duty to perform? So I think ideology starts playing an important role here in terms of resistance. And if I think about instinct, government officers have served 37, 38 years in service, right? They've gone from the bottom up to the highest rung of bureaucracy. So they do have a lot of valuable knowledge, and most often they rely on gut or instinct to take a decision. So when we come to them with a program that we say is evidence backed, a lot of times you'll hear that, I think that this is what is really needed, because they are responding to from their knowledge perspective with their instinct or their gut. And lastly, I think with good evidence and with persuasion, building good relationships, you can overcome this. You can persuade them to take action based on evidence, but ultimately inertia, I think for me, has been the biggest struggle. The inertia in terms of there's very little capacity in the system to be able to with it. So little capacity within systems to implement and scale up programs based on evidence. So in the face of this, how do you really possibly overcome that? So finally, I think from outside of a normal world, especially at a time like this, I do believe that policymakers are in emergency response mode. So while we can take the best evidence to them, it has to be very, very relevant to some of what the challenges they're facing right now. They're battling daily fires, and while we can take evidence to them, they might not have the bandwidth to implement.
Really interesting. What is your take on this question, Anna?
So to sort of add to Shobini's remarks, if I take a few steps back and you hinted at this, Mary, when you asked the question, and look at where the evidence to policy community and JPAL is today, I think we approach this crisis with a much stronger skill set and stronger demand for robust evidence than ever. So as JPAL, I think we're much better equipped to talk to policymakers than we were a decade ago. First, because we have more evidence to share. We've just hit 1,000 evaluations completed or ongoing within the network, including over 300 in Africa and also a significant share in India. So this now gives us a sort of significant portfolio across sectors and a better voice in many decision forums and policymakers communities. We've also developed tools to leverage this evidence better. Among others, we assess replicability of proven interventions through our generalizability framework, and have now used this enough time in engagements with policymakers that we think it's useful and practical to use. The second point, I think, is that the wider than JPAL, the evidence to policy ecosystem has grown to be more diverse. I would now include in this definition organizations with less of an academic focus. On the African continent, I'm thinking of organizations like ID Insights, IDs 42, Busara, and as a community of organizations, both anchored in academia and sort of more independent organizations, we're better organized, better coordinated. We collaborate very closely with IPA on the African continent, and many JPAL affiliate studies are implemented by them. But we also collaborate on given ad hoc policy engagements like IDs 42 in the Western Cape, where we bring, I think, complementary skill sets and different approaches on use of evidence. And sort of to briefly answer your point on the why, I think this growth, Shobini addressed this, but I think also this growth is partly thanks to major development funders like the World Bank, DFID, the Gates and Hewlett Foundations, but also new generation funders like Co-Impact, supporting the RCT methodology, engaging with the evidence that was generated through these studies, and funding the scale up of proven interventions. This has really been a game changer, I think, in providing not only funding, but also political clout in support of this.
Okay, fantastic. Thank you both for that. Now, the next question is around how do you define scale up? What is your experience of working with policymakers for scale up? What are the key learnings and challenges? So Shabini, let's go to you as the lead on this answer. We'd love to have you lead off with that answer, particularly in light of some of the comments you had initially about the way in which policymakers operate in this environment, and the inertia that might be in place with policy contexts and the instincts that the policymakers will typically go on.
Sure, Mary. So as I talk about scale ups, let me take a step back and talk a little bit about what our mission is. The foundations on which JPAL was built is to base decision making on evidence and data and go from innovations to scale to deliver impacts at large scale. So we work very closely with NGOs, governments, and policymakers to first understand the problem, diagnose what the issues are, where the gaps are, what design solutions with them, test these solutions, and finally work in the same context or in different contexts to scale up based upon the evidence that we have generated. A usual JPAL evaluation will have about 5,000 to 10,000 people enroll in a study, 3,000 to 4,000 households on an average. And when scaled up, we usually target not less than an entire state in India, which is an average of a population of anything from, say, 30 million to 60 million, or go nationwide. So that's the sort of... to date, about 400 million people have been reached by programs that were scaled up after being evaluated by JPAL researchers worldwide. And many more have benefited in several broader ways based upon some of the insights that we have used to inform, sort of tweak certain smaller wins, smaller changes. So I think I would say that, before I want to give an example, but before I get there, I want to say 2-3 things. First is that a well-designed randomized evaluation can provide insights not only into the final impact, but also it can give you an insight into why certain things work and why the program works. So in addition to learning about the impact of a program, researchers often are able to draw mechanisms about the levers of why this program is successful, which helps us derive lessons not only in the same context, but across contexts. So, and I can talk a little bit more about the application in a different context after me. And programs that have, and I would say that, for this, I think it's also equally important to also look at what doesn't work. So we have many evaluations that we have done where we have had null effects or even negative effects. So it's equally important to learn from that and not scale up. And we have had some successes where governments have actively not put in resources to scale up something that we have found that doesn't work. So what it does is scaling down or not scaling up. It has also shown that you can free up valuable resources and create the opportunity to be able to try something new. But we've also had situations where the governments have gone with their instinct and said, you know what, I think I still want to go ahead with it. And of course, there are institutional constraints that play here. So that, of course, we cannot help. So now, as I want to give, I want to start with an example here in terms of what we have scaled up. One of the most powerful examples, rather, of scaling up, which has moved borders across countries from India to Africa. And this innovation that I'm going to talk about also found mention in the Nobel Committee's recommendation on awarding the Nobel to Abhijit, Esther, and Michael Kremer for their work. And so if you visit the Nobel Museum, you'll see a memento from this research over there as well. So let's start with I'll give you a little bit of context. It's coming from the education sector. So if you think about the current context with school closures, there is going to be large, massive learning gaps for kids when schools reopen. Not everyone is going to be able to move to digital technology, especially not in a country like India, where you might have huge mobile phone penetration, but you're probably not going to have, be able to get onto a Zoom class with your teacher. And government school teachers, of course, I don't know how the infrastructure would be able to spread in rural parts of India. So even now, schools open, there's a classic debate of reducing the curriculum, but then I guess reducing the curriculum assumes that kids are already at.
Oh, it looks like we've lost Shabini for a minute. Anna, do you want to come?
Yeah.
There we go. Here she
I
is.
think she's coming
Shabini,
back.
we're losing you a little bit. This is just the nature of some of these calls are dependent on our Wi-Fi networks. Anna, can I ask you to step in and take over the description there, and then we'll wait for Shabini to come back. Thanks.
Sure, no problem. Yeah, it's illustrating how unreliable data connections, even with the best equipment, can be. Yeah, so if I pick it up from where Shabini left it, I think so. So she was going to introduce teaching at the right level, which is a program initially developed by Pratham, one of the largest Indian NGOs, and that aims at leveling up children basic skills in literacy and numeracy. Shabini's back.
Shabini.
I'm back.
Back.
We lost you. We lost you through quite a bit of that. So I think maybe just tell us a little bit more about teaching at the right level and the context in which we're all now operating with children coming back into school, having been disrupted by the current crisis.
So I'm back. So should I continue?
Yes.
Yeah.
Yes, please continue.
Okay. Great. So I hope you got what I was trying to say. I was trying to make a case for children catching up when schools reopen, and why teaching at the right level as a program, as an innovation, is even more pertinent in the current context. Because once schools reopen, they will face a huge disadvantage, and they're not up to pace with the curriculum, and they're going to lag further behind. So in India, if you look at statistics, more than half of kids in grade 5 are unable to do simple math operations of grade 2 level, and unable to even read simple text. So over the last 2 decades, JPAL has evaluated an innovative learning program for teaching at the right level, which was originally developed by Pratham, an NGO, which is a very large NGO, education-based NGO in India. And it's a model that focuses on developing foundational skills in language, which is simple reading, simple text reading, as well as being in math, being able to do simple number operations. And this works really well for disadvantaged communities in rural and urban parts of India. And we have repeatedly evaluated it through randomized evaluations in the last 10 to 12 years. So this is one of the most, I would say, evaluated programs across different contexts. The idea behind this is very, very simple. Children are first quickly assessed with a simple testing tool for language and for math to understand where they are at in performing simple operations and being able to read a grade 2 level text. Whether it's letter, words, paragraphs. And then they're regrouped, not by the grade that they're in, but by the ability level. And so that the teacher is able to target instruction and different activities to the ability level of the child, based upon the grouping, who are at the same level of learning. So this helps kids progress systematically over the duration of the program. Kids move from one grouping to another as they progress. So it's very, very fluid, very fast. You have to continuously do retesting to move kids up. And this enables children to gain basic reading and arithmetic skills within a very short period of time. And so in the last 10 years, led a team of, so have been able to sort of, evaluate different versions of this program. And the numbers were very large. So we've evaluated, a single evaluation has contained between 10 to 18,000 children across, say, anything from 200 to 400 government schools, both in the communities as well as in government schools. So it has been found to be effective and delivered by volunteers in communities or by government school teachers in schools, and within a very short period of time. So like I said, I think we've, just very quick, I would say, headline in terms of what we found. We found that almost twice as many children in grades 3 to 5 were exposed to, say, the learning camps in communities, could read 4-sentence texts as compared to children who are not enrolled in these learning camps. We've had similar, slightly low, we've had very good sort of impacts even in the government school system, slightly lower. It's been delivered through the government school system, where 1 hour a day, you sort of took all the kids from 3 to 5 grades and reorganized them for 1 hour a day to focus on foundational skills. So very quickly, in terms of what we've learned, the second question you asked, Mary, was working with governments and in scaling up. And so through this program, we have now we are working with Pratham, and Pratham themselves are working with state governments to scale this program up in many states. The journey of scaling up, even within India, has not been linear. So you have to take it from one state to another. The context changes. You have to work with different bureaucracies to be able to influence them. And something as simple as teaching at the right level, unfortunately, does not have the excitement of a digital learning program, for example. And it also goes against the narrative of, spend more money on building more schools, infrastructure, textbooks, get more teachers, right? So we had to go against all of that. And if you see in India, there has been a lot of spending on education, but the learning hasn't been able to keep pace with that. So the gains, when we've also evaluated a lot of these input-driven expenditures, and the gains like textbooks, libraries, uniforms, improving student-teacher ratio, these gains was not comparable to the benefits of that the TRL's soft pedagogy has brought. So I think I'll talk about 2-3 things. One, and when you work with governments, first of all, it's just building relationship with governments all the way from the top to the bottom. That's been very valuable in anything from carrying out new research to scaling up. And when you do have results, if you have a trust with the governments, when it comes to scaling up, they are more amenable to be able to scale up because they know that you're there as a long-term partner. You also need to build a relationship with the middle and lower levels of the bureaucracy, because it is ultimately that cadre that has feet on the ground to be able to scale up, no matter what the directives come from the top. So we've been fairly, I guess, successful in trying to influence different levels of the bureaucracy. And in India, we have to work our way through very lengthy bureaucratic procedures, government orders. It takes a long time for an order to reach down to the village level. So our research and policy teams have been very successful in building great relationships on the ground. And the government officers and the field officers we've worked with on the ground have been quite good. They've shown a lot of dedication in scaling up these programs on the ground. So a lot of learning there, and I can talk endlessly about how we've been able to do that. And there's also some materials I can share with you later on. The second is actually creating institutional processes. Within this TRL, that within each of these different TRL evaluations I'm talking about, we had about 3 successive education secretaries change. Each of them could have overturned the program, right? But what we did was we built institutional processes. We had all the requisite paperwork, but we also had some mechanisms of giving a quarterly feedback to because it was an order, and then we would talk to the new secretary, whoever was there. So I think one of the key models we found, and this is not just for scaling up, but in general, is to create institutional partnerships with governments where we have regular policy dialogues. And we anchor it within the central nodal department. So whether it's with the finance and planning, or within the chief minister's office, or a nodal authority like that. Then it's useful to identify a policymaker or a champion who really believes in an evidence-informed policy making, because that's the person who is going to then influence other departments and their colleagues. What we've done in the past is to create an innovation fund to be able to fund new research and scale-ups. So these are some of the things I think that have helped us in terms of having a seat on the table and being able to influence a scale-up when the time has come. And lastly, I'll say that we've learned that governments need, and I will talk more about this, I'm sure, but they need technical support to operationalize a new program in drawing up the blueprints. So going from translating the findings from the studies into specific implementation plans, it's not very easy to do that. You can't give an academic paper or even a policy brief to a policymaker and say, now go figure and scale this up. So we need to be involved every step of the way, even in the scaling up. And it's surprising how often small things can get missed out when you're translating lessons from a randomized evaluation to an actionable implementation plan. And the devil is really in the details. So one very quick example I'll give before I stop is drawing from TRL. When implemented by school teachers in a school setting, we found that the supervisory cadre of cluster officers one level above the teachers were very instrumental in being a key lever to drive that change. They were not monitors, they were mentors. They were a cluster of card supervisory officers, but because they went through the program themselves, they had to actually go into classrooms for a month to teach children, and they saw that program roll out in front of their eyes. They were able to better mentor the teachers. And that was a very key driver of our success of the intervention. And then I think just 2-3 things I'll say that some processes are important that get missed out. For example, what are the funding mechanisms for that? Where is the money coming from for that scale up from the government body? And what we have found is that, if there's money coming from the center to the state to that department, we don't have all of those pieces in place, it's not going to get scaled up. So our scale up got derailed in a state because the money didn't come on time. It came 8 months into the school year. So that school year was a washout, right? So we had to push it to the next year. But these are some of the things that I think we have to keep in mind as we are looking for scaling up. And I think policy windows matter a lot. You have to be there at the right time to be able to capitalize on the opportunity.
Anna, what are your reflections on defining scale up and working with policymakers and the opportunities and challenges to work with policymakers on scale up?
Also, actually, if I can follow on what the discussion that should be started around teaching at the right level, with one of our flagship projects at JPAL Africa is replicating teaching at the right level on the continent, and moving it from India to sub-Saharan Africa. And I think that's quite a good example to sort of bounce ideas and additional ideas and learning on what does it mean to move from evidence to policy. And I think one of the first challenge that you face when you take something from one context to another, be it between 2 states or between 2 continents, is simply of entering a new geography, whatever it may be. So the approach, teaching at the right level, takes inspiration from what's developed over many years in India. And as with many programs, they start as a grassroots effort, grow to become larger organizations, and it's an organic process. When you try to replicate something or scale something up to other contexts, it's by definition not as organic a process. So you need to build the infrastructure to implement well. You need to think through replicability and adaptations needed, and you need to get buy-in locally where you're developing this. And maybe South Africa is an extreme example of that, but to answer the infrastructure challenge, we adopted a movement building strategy, working with a 3-pronged approach. So direct support to government systems in Zambia, Nigeria, and Ivory Coast, but also beyond that technical advice and direct support to governments, supporting highly effective partner organizations working themselves with government systems, like Young Love, an NGO in Botswana. So leveraging also people who have an existing knowledge and existing relationships to replicate. And then a wider community of practice. So a network of strong NGOs who can innovate, learn, and demonstrate teaching at the right level approaches to catalyze a movement across the continent. So that's sort of creating an infrastructure from scratch, if you will, as opposed to Prasam's journey in India, which was several decades long. And to answer the issues around adapting to local context, the strategy chosen was to focus on deep, direct engagements with governments in select countries, rather than sort of high-level, light-touch advisory with many more governments or education actors. And this builds on Shobini's point around you need technical advisory means also being in the trenches with policymakers when they're facing delivery challenges. Otherwise, coming in, advising on design, and then stepping out doesn't work. It doesn't get you there. And also, if you abandon the relationship at that point, Shobini is right, some details of the implementation will get lost. And your end product or policy or service might have very little to do with the original sort of causal mechanism that you identified to be effective. That means concretely advising the Côte d'Ivoire government through teacher strikes. The first year of our implementation was hindered by large-scale teacher strikes, and since we focus on government implementation, it was a huge issue. So literally being in the trenches of thinking, okay, we had planned the sort of to do the assessments at this time and have volunteers and teacher trainings during these times, and now we have to shift that timeline here or there. So very concrete, very tactical. I think another point around adapting to a local context is the composition of the teams. And the Teaching at the Right Level Africa experience have been really interesting because we work with a mix of Pratham staff who have first-hand experience of implementing this in India, JPAL staff who have the experience of advising policymakers and thinking through these replicability questions, but also country nationals with a deep knowledge of their own education system, who can also broker the relationships at different levels of government. And then I think in terms of cultural changes, Africa versus India specifically, there are learning curves, I think, around adapting to different cultural contexts. The Pratham team working with us often comments that engaging with governments in India is very different than Ivory Coast, Nigeria, and Zambia. I often hear that India is much more relationship-based in their view than African governments, who can be quite formal in their engagements. But I think the fragmentation of the continent and the diversity of context is a challenge for everyone, not only our India-based teams. So when you think about the three contexts where we have direct implementation, North Nigeria is a protracted conflict space with extremely large class sizes. We're talking 100 to 100 students per class. Zambia is very different. It's a very resource constrained government and isolated rural communities with, on the contrary, not necessarily very large class sizes. And Côte d'Ivoire is a formal French inherited school system where we had to adapt approaches to another language entirely. So again, to sort of give you a sense of how concrete technical advisory can be. And what we're learning about this experience is maybe a little trivial and again quite tactical, but I think valuable. The key to implementation is competent local teams. Recruitment has been a major priority, and here on the African continent, I think it's always a challenge to find committed local leadership and crafting small but highly effective teams, especially when you don't have necessarily a big brand as an employer, unlike Pratham, a big NGO does in India, and working in less attractive areas. And team culture, I would say, is also a critical lever. A big part of the successful magic of Pratham is the cohesive, committed organization culture that they built. It's something quite fantastic, and I think it is a driver of impact, or at least effective delivery. So building this will take a long time, reflecting a little bit more on sort of what we do internally to build something, to be an effective team that accompanies policymakers. I think also just a closing remark that might open a whole kind of questions, but the importance, like the size and the complexity of the development ecosystem in Africa is both a hindrance and an enabler to implementation. It means that there are huge funding opportunities available for education programs from DFID or USAID, like large funders. But it also means there's a whole industry and bureaucracy set up to award and monitor these. So that's something, to be honest with you, that we still on the learning curve for. So South Africa is learning to navigate this, and I think the jury is still out on how much this helps versus hinders us.
Wow, thank you both for such interesting reflections. It's great to have the example of teaching at the right level to kind of focus the discussion, because it's not only moved to numerous Indian states and been studied extensively, it's also now moved continents and moved to many different countries within sub-Saharan Africa, which sound like they're all presenting different implementation challenges. So really fascinating to hear your mutual reflections on that. Just one note, we'll ask one more question of our panel, and then we'll probably move on to our Q&A. May I request that folks who would like to ask a question, pop those in the Q&A box at the bottom of the screen. So the last question, we addressed this a little bit in the first question. So Shivani, you talked about this a little bit, but it would be really useful to hear how COVID has affected your work. What have been the key challenges, and what long-term effects do you expect it will have, both positive and negative? And we'll start with you, Shivani, please.
Sure. So Mary, I think I think we're all aware that this COVID-19 pandemic is probably the largest, most synchronized shock the world has ever faced in generations. And I see the effects persisting for a really long period across several facets, social and economic, and also altering the way some sectors even function and work, and of course, completely changing the way we work. So for JPAL, for organizations like JPAL, what it has done is, in this research and policy space, while our problems are small compared to many others, and to what the world is facing, we've had to really sharply pivot to meet the demands of the current times of our partners, and change our modus operandi to contribute meaningfully. Now, in terms of, let me talk a little bit very quickly about some of the harder impacts on our organization. So just our bread and butter, our field operations are completely stalled. We are not able to engage in new field-based research so we've been shut since March. So it's been 5 months of complete lockdown for us, and I'm sure it's the same for everywhere. And mainly, I think partly also our partners are also quite badly affected because their implementation is also stalled. There's been reduction in budgets, so of course, our budgets might not even last a prolonged lockdown. So while we have been able to move to phone service relatively quickly, it's not been uniformly across all our projects. So we have about, just to give you an idea, we have 82 field-based projects in India ongoing before the pandemic. Not more than about 15 of those have been able to move to phone service. So that's really the impact of the lockdown on our work. And I think just at a slightly broader level, it's also shifting away our attention from critical research. So there is so much that we are lending. The pandemic is one part of the problem, but there are problems that existed even before the pandemic, and things like routine immunization, for example, right? So it's shifting away from pressing problems. It is stalling any of the scale-ups that are happening across different countries that we are working in. And even with, so governments, of course, their attention is shifted, but even with donors, we've had some significant committed funding put on hold due to the impact of lockdown. So it includes funding for scale-ups, includes funding for new research in critical areas. So this work and ecosystem has sharply pivoted to the pandemic in one sense, but it's also taking away from a lot of other things. And of course, for us, we are having to pivot. So our business as usual has been quite affected. So in fact, we had to lay off in South Asia about 1,000 field staff enumerators. Barely, if 15 projects are moving, so we are barely able to have 200 or 300 field enumerators, right? So we were able to support them. So we raised money to be able to support them for almost 10 weeks of lockdown. But beyond that, I think we are, we can bring them back on once the field research starts. So whenever that is. So those are just immediate, I would say, pain points for us. And it's the same for a lot of organizations in our space. But I want to quickly shift gears to talk about some of the positives. There have been some positives that have emerged out of the lockdown. So if I were to think about what they were, so given the mission that JPAL has, which is evidence-informed policymaking, and I did talk a little bit about why organizations like ours are very relevant, especially at this point of time. Given the deep partnerships that we have had across many of the state governments that we're working with, we've been able to provide policy advice and new research to be able to inform governments in real time with some of the pressing issues. And I'm happy to talk a little bit more about it if given time. But as of July, we've, amongst the 15 I mentioned, if we pivoted, we have also, a lot of them have changed the nature of the questions that they were asking with the respondents to be able to capture a lot of information related to the pandemic. There have been a few that were new, but a lot of ongoing research also pivoted. So the pandemic has forced our researchers to also think about sort of the way we think about solutions. And we are, as feet on the ground, have had to think about how to deliver these solutions. So right now we've got phone surveys going on across India. About 100,000 respondents across different studies are right now being contacted through phone surveys, which is huge. For something, phone surveys were not really a part of our modus operandi even 5 months ago. And we've been able to also, interestingly, reach more vulnerable pockets of population. So we've been able to reach through this populations who might not even come in a generic survey. So for example, diabetic patients, dialysis patients, migrant workers, of course, frontline health workers, elderly populations, people with mental health issues.
Oh, I think we may have lost her or I keep waiting for her to come back on, but let's move to you, Anna, to pick up this question on how COVID has affected your work. You might need to come off unmute yourself.
Yeah, sure. So yeah, sure. I think so. Similar to the situation in South Asia, the pandemic has had very disturbing effects on our teams here in Africa. But trying to sort of see the positives and what changes it brought that I hope will have good consequences in the future. Pivoting for us at JPAL Africa has meant a lot of the time leveraging existing samples and existing studies to be useful, either to learn useful things or to provide descriptive data to policymakers that is useful to them in immediate decision making. For example, JPAL runs initiatives that are themed on in a sector or specific set of questions. And our Digify initiative, which is focused on funding research on digital payments and identity in Africa, has provided additional funding to 2 RCTs, including a study on universal basic income in Kenya, to understand whether and how UBI moderates the impact of the pandemic, as well as the transmission of the disease. And many other JPAL initiatives, in fact, most have done the same. And I believe we've awarded over $1 million of funding through about 25 grants to date for existing RCTs, which were either using remote surveying or moved to remote surveying to orient their research questions towards answering immediate COVID-19 relevant questions. In South Africa, another example is we work with a lot of youth unemployment services in South Africa and partners who offer either matching services or support internship programs to encourage young people, or to help young people to enter the labor market. But here, simply demand from firms, employment demand has dried up dramatically in the past few months. And so we've pivoted our research resources to surveying firms instead of work seekers to learn more about their hiring priorities and outlook. So that's another example of being very tactical and serving our evaluation partners for a short period of time. I think what's been really less on the research side, but more on the policy side, it's been incredibly challenging to engage with policymakers at this time. Priorities have shifted dramatically. They continue to shift constantly. And we're not set up for emergency response as an organization. this has definitely been a challenge in terms of how we digest the evidence, prepare it for engagement with policymakers. Our regular process to present this evidence to external audiences is quite stringent with many controls, because we like to be exact. And this is rightly funded in our desire for intellectual accuracy. But we needed to move fast, and JPAL Africa, along with other offices, put together evidence briefs and held webinars on things such as effective messaging in health, but also what you can do about gender-based violence. And I hope this means that as an organization, this episode of having to circumvent our normal process a little bit means that we become a bit more agile whilst maintaining that rigor. It was a good push. And finally, if I try again to look at the positives in this fairly grim landscape, our president, Mr. Ramaphosa in South Africa, is often heard saying, "Don't waste a crisis." Not to the public, but to his advisors. And I hope that we'll be able to seize learning opportunities that will come in the next 2 years. This crisis should give a platform for politicians to pass ambitious policies, and I think will give us a once-in-a-lifetime type of opportunities to learn whether these policies are effective or not. I think there's a big minus, which is just hoping that the funding and the political will be there for the learning part. But certainly, I see opportunities going forward. Shobini, back to you. I'm sorry you froze.
Yes, so this is one of the issues with the current situation. I think our networks are so saturated that they're not able to support uninterrupted supply. Okay, so I think just very quickly, I will not take much time, but Anna has really spoken about wide range of things. But just coming back on the research front, I just wanted to talk about something really interesting. I think one of the things that we've learned, I hope you heard about the time when I was talking about the different kinds of vulnerable populations that we've been able to access. Perfect. So then you heard the important part. Now, I think we've also had a lot of learning through this pandemic around the mode of data collection. So as we move to phone surveys, a lot of interesting, important learning about data security, ethics, being mindful of the respondents' time, how do we recruit, train, and monitor remote surveys. So these have just been some of the practical things that we have learned, which will remain with us even beyond for the future. So I don't see us turning back from this right now, but I wanted to give you a very quick example on an innovative design construct. So I did talk about how researchers have been forced to rethink, right, in terms of what the interventions could look like. And I'll give you a very quick example of what we've managed to do, and we've got results from the last 1 week. So this is really exciting around a behavior change communication model at a time like this, communication campaign. So during such times, you will see we are inundated with messages on preservative healthcare behaviors. I keep getting, if I call somebody, the government speaks to me on the phone about social distancing, hand washing, all of that. So a study during this pandemic by a few researchers, including Abhijit Banerjee, Esther Duflo, and several other researchers. It's a really long list of researchers. They carried out a very large scale messaging campaign in an eastern part of India between April and May during the pandemic. And okay, I think somebody says they're having connectivity issues. So I'll try and speak slower, and I hope you don't lose me. But they conducted a large-scale messaging campaign in an eastern part of India between April and May earlier this year, during the pandemic, to look at whether how do you reach a large population of a state through light touch messaging. And what this light touch messaging was, essentially, you looked at, and then they used, okay, so before I go to the messaging, it's very interesting. They used like a local hero. So how do you give information, light touch messaging, using a local hero or a heroine to be able to influence behavior change? And this is like the fastest turnaround of an RCT that I have seen with huge policy impact. So 25 million people in the state of West Bengal in Eastern India was sent an SMS with a 2.5-minute video clip delivered, and the video, who was speaking in the video? Abhijit Banerjee, who's a native of the state and a local hero because of the Nobel Prize. So he was the intervention here. And all the messages encouraged reporting symptoms to local healthcare workers, as well as they emphasized one, health preserving behavior, so social distancing or hygiene, and one, motivation for action, which is how it will affect others around you or yourself. And some messages also addressed the ostracizing issues related to COVID. So we found that reporting to community health workers doubled, and there were increased adherence to preventative behavior such as hand washing and returning home upon returning home among the 25 million recipients of this message, with spillover effects even to those who did not get this message. So I think the unique features here that forced us to as researchers to really push the frontiers, there was no pure control. It would have been unethical not to give a message to anyone. So there was no pure control. 3 million individuals received the government message. So that was, I would say, in a way, the control, if you think about it. And the treatment arms were different, were Abhijit's video with different messages. And these messages were randomized by the PIN code level. We didn't have access to phone numbers, and that's been a big challenge for us pivoting to phone surveys. So we tied up with a telephone operator who sent out these mass messages randomized by PIN codes. And for the end line, so there was no baseline, firstly. And for the end line, what did we do? We reached out to the local village council leaders. So they have publicly, their phone numbers are publicly available in all data sets online. So, so one person recommends, say, so we reach out to one Gram Panchayat member. He recommended 5 people, who recommended 5 people. So it's called Snowball Sampling. So we use Snowball Sampling to reach about 70,000 or more individuals to be able to understand the effects of this, of the messaging. And that's how so that's been a big learning in terms of pushing the frontiers of research as well. And if I have a minute more, I think just to talk about, build up on what Anna said, when we talk to policymakers and the pressing needs that they have, one of the big gaps this pandemic has created in terms of a future shock perspective is actually a lot of vulnerable populations. We were caught blindsided by 65 million migrant workers in India who migrate from villages to cities, who were completely left without any protection. So the social protection architecture is being forced to reinvent itself to be future ready, to be able to be more inclusive, rapid, and more dynamic, to be able to include all of these. So I will not talk more about this, but that's another, I think that's a key part of some of the unintended effects, which are having some positives in terms of how we are pivoting and how governments are pivoting, most important.
Oh, fantastic. Well, look, you both have been so fascinating and such a detailed, rich conversation. I'm afraid I don't think we're going to have time for Q&A if we intend to end, told all of our participants we will. But what I would like to ask you both for is maybe a 60-second closing remarks, maybe 30-second closing remarks, and then I'll provide some close to the session. So Anna, why don't you lead us off there?
Sure. So I think by closing, I might loop this back to Ruth's article about the Global South and say that I think a lot of innovation and learning will continue to come. I don't think that's a new thing from the pandemic, but I think will continue to come from the African continent and the Global South in general. For me, I'm particularly interested in what Shobini mentioned around social protection, questions of universal basic income and cash transfers. And I think it will be interesting to see out of this pandemic if we see the global north taking on some of the learning and thinking about replication of some of the programs that we've evaluated in the South. Great, thank you. And Shobini, any thoughts from you?
That was a great closing from Anna, so I will not take much more time. But I will say that I think there's a lot that we have learned as JPAL in the past decade, 2 decades or more, in terms of how do we inform evidence-based policy making. And a lot of those lessons are coming to light now, especially in the face of how we are pivoting in the pandemic. And we've been able to do that because of the investment of our people across regional offices, because of the investment of our researchers and the fantastic work that they are continuing to do.
Fantastic. Well, look, thank you both very much. The questions that have been asked we'll take on board after this session, and the panelists will have access to those and may be able to respond to them. So thanks to those who did ask questions. I'd just like to close out the session by thanking, of course, our excellent panel and also by mentioning our next webinar, which we'll get a slide up in a second. So we have a next webinar, which will be on the 19th of August. We're really excited to be joined by the Chief Executive Officer of Nesta, the UK's leading innovation agency, Ravi Gurumurthy, who used to be at the IRC. So he's going to be a really interesting voice around innovation and the use of evidence within an innovation context. And Joe Taylor, who's the Chief Capabilities Officer at the Paul Ramsay Foundation, which is one of Australia's largest foundations and has a very evidence-driven approach and also a very innovation-driven approach. So we'll be exploring the ideas around evidence use in innovation settings in that context, and look forward very much to having you join us then. Thank you so much for joining us today, and look forward to seeing you at the next event.